Hi, I'm Niki Faldemolaei. Welcome to our disruption. In the advent of COVID-19, this pandemic has forced businesses to pivot and retool and basically come up with rapid solutions to solve problems. We were very much in a position to help. In a time when people do not want to visit the ER or the clinic or a hospital or your busy practitioner's office, this is a perfect tool to use telemedicine, your professional, in tandem with your own device, and track the proper sounds, the breath sounds, the carotid artery sounds, anything that's going on in the cardiopulmonary system. With cardiovascular disease being the top killer of humans on this planet, we've been able to take a cardiopulmonary approach and tackle COVID-19 by listening to not only the carotid sounds and the arterial flow and the oxygenation, which feeds the entire body system, but take the pulmonary sounds and catch that COVID cough in its early stage, or catch a state of pneumonia and predict whether or not that's going to get into a state as bad as COVID. And it also predicts and or monitors the body's flow in such a way that if your organs are starting to fail because you're in a more advanced state, then it's going to give you the feedback that you need to make smart decisions early and catch this thing before it gets to a state of demise. Let me introduce our co-founders, and they'll tell you a little bit more.
Hi, I'm Michael Bloxton, co-founder of BodyTune. We are very excited to talk about this project. We originally created this thinking about exponential technologies from sensors to machine learning, AI, mobile devices, and the full gamut. And we identified an opportunity to create a very, very cheap device that someone can carry around in their pocket, connected to their mobile phone, and literally listen to what's going on in their body in a way that no one ever has. Specifically, we were listening to the blood flow in between heartbeats using a device that at scale costs dollars to pennies. When COVID-19 hit, we realized that there may be a very, very big opportunity thinking from a pulmonary perspective versus a carotid perspective, leveraging all the same device, hardware, and software, machine learning, exponential technology to be able to identify, before a patient may be able to identify, potential symptoms of COVID-19. We are very excited to explore this and see how we can leverage further the ability to take all these exponential technologies together and apply them to this pandemic.
Hello, my name is Michael Friebe. I want to present you today a device that we have developed in our university lab. It's based on sound, analyzing sound profiles. That's something called auscultation, is listening to the sounds that are generated inside a body and extract information from it. A stethoscope is a good example for that, and also a digital stethoscope. But that's very difficult to quantify and classify events. So we have been able to actually extract with advanced signal processing information from that sound profiles, and we're even able to characterize individuals just based on their profiles and on that sound profiles. So it's very interesting, and we believe that we can monitor disease stages, particular stenosis, and that we are able to actually use this information in the future to predict and monitor disease stages. One of the ideas to use this device for is actually obviously to miniaturize it, to connect it to smartphones, and then be able to look at your own flow profile, see changes, and see what, for example, diets do, what pharmaceutical does, have a connection to a clinician, and with big data approaches, artificial intelligence, machine learning approaches, extract information that would give further information on disease stage. So with respect to COVID-19 and related diseases that affect the lungs, we believe that we can use the sound profiles from the lung, create a personalized and individual baseline, a healthy baseline, and then be able to monitor actually changes of the lung in combination with the resting heart rate, which is also an important parameter for determining whether you have a lung disease or not. And then create certain metrics that allow us, together with a deep learning and big data approaches, to classify and quantify disease stages of the lung.
Thanks for listening. We appreciate your input And we really want you to be a part of the team, whether you're a data input person testing the device yourself, or whether you're a funding partner with us. We love to have you join us in this solution to a very, very critical problem and the disruption of what I consider to be sick care. No longer are we going to be symptom-based. We're going to be monitoring and tracking and predicting and solving this thing, taking self-health care back into our own hands.